We've moved to having teams at Ellsworth Internal Medicine. We divided into 2 teams, the green and the blue team. And the idea is to have continuity for our patients, that they have a team with the same roaming staff, nursing, and providers all working together. This will hopefully provide more continuity and access for our patients and more consistency of the people that they see, especially within the office. Yeah.
We really hope that patients will see that this transition is rather seamless. They will maintain their primary care provider, and in the meantime we'll also educate them that they are part of a team-based care model in terms of having an entire team who can see them. So if their primary care provider is not available the day they want to be seen, we'd be able to see any other provider on that team, and we think that for patients, they will feel like there's better access, more availability, and more people to actually wrap them up in care.
So we have a pharmacist who's been extremely helpful with lots of different kinds of pharmacy-related problems for our patients. We have care managers helping our more complicated patients.
We have a behavioral health person, yes. A social worker who is actually here in the building who can see patients on site, and we have found that patients are more likely to come because they consider this their patient-centered medical home, the medical place where they go and get all the care they need.
So the other thing that's really exciting about the team model is improved morale and communication within the office. So the MA is actually in the same office space with the provider. There's camaraderie that has built up and a sense of better care for the patients, for the providers themselves, which is great.
We have construction ongoing on the site to help address our space needs as well as our integration of information systems. So we feel very confident within the next 2 months we're going to have a multi-practitioner practice here at Coastal Health Center. This will be the resort way of North Ellsworth.
So there are many exciting things that are happening in orthopedics at this time. We're building a team approach to the administration of all of the specialties of orthopedics. Right now we have a hand and upper shoulder specialist, we have a shoulder and elbow specialist, I'm a sports medicine specialist, we have a total joint specialist coming on board in the next 1 to 2 weeks, and we're looking actively at a foot and ankle specialist. Other than spine, that covers all of the parts of the body. And what I like to tell people is that my job, and I take it very seriously, and the entire orthopedic division feels this way, is getting you old in the very youngest way possible. And that requires a team approach. That requires you being the head of the team, and it requires us doing our very best to get you there. And remember that sports medicine is a team approach, just like orthopedics is a team approach. And I rely very heavily on the physical therapists. I rely very heavily on the strength and conditioning people. I rely very heavily on the team of nurses, the wonderful team of nurses I have here in the hospital and here in my office that administer to all of the myriad of things that come up in the care of a patient.
Together with PT, OT, the nursing staff, care managers, and my office staff, we've worked really hard to build a team that works focused on the patient experience, making sure that when a patient finally decides to have a total joint done, that it's a collaborative effort from everybody involved.
I think the key is that nursing and physical therapy really have to work together. If my patient is having pain control issues or they didn't get a good night's sleep last night, the likelihood that they're going to be able to get up and walk and fully participate in PT and OT is pretty slim. So we really do rely heavily on the nurses to make sure the patients are well medicated and are getting the sleep that they need at night. We also rely on our case management team. They're the ones that help that patient take the next step, whether it's going home or going to a rehab facility, and that's key because home physical therapy and that next step is just as important as the 3 to 5 days that you have here in the hospital.
When you have a patient come back for their 1-month follow-up, and that's not to say that they haven't been in the office leading up to that, but when they come back for their 1-month follow-up, and they can look at you and say, I'm so glad I had this done. And every single person that worked with me knew exactly what they were supposed to be doing, and I knew exactly what they were supposed to be doing, and you are a fine-tuned machine.
The Patient Advisory Council is a group of some employees, some community members, led by Stacy Brown. We get together once a month and we talk about problems that different teams here in the hospital have identified and try to give them a new perspective on problem solving.
We had a charter which basically described that we would have 6 patients or patient family members, as well as 6 frontline employees who would be on our council. And we would join together to discuss issues facing the hospital that would really focus on inpatient quality, safety, and also on the patient experience.
I think it helps the visibility of the hospital and all of the good that we're doing, having community members involved instead of just trying to do it all ourselves.
So when we started the advisory council, we wanted to talk about the Falls program because that was one of our areas that we were really interested in improving. So I went down and I presented some of the things that we had in place to the advisory council. Then I took them upstairs on a tour and I had them get in the bed, I had them lay down, use all the tools that we do to keep the patients safe, and then ask them to tear it apart and give me feedback on how we could make it better, how we could make our patients buy in more to our falls prevention program. We were able to drop our fall rate from 5.7 to 1.3 falls per 100 patient days. So that was a significant drop considering the national average is 3.7. The site for callback is very targeted towards discharge planning, discharge instructions, medications, if they had trouble filling their prescriptions, and general satisfaction of our patients. We're able to implement changes based on feedback that we get, whether it's food or heat or a kind word that was said. It's really great because we're also able to give the staff that feedback immediately after the patient has gone, and we're not waiting for comments to come in from some of our other avenues. So it really gives us an opportunity to celebrate as well as make changes and help people along the way.
It's nice to work in a community hospital where you're able to cross-train to different units so that if the opportunity ever came up that you wanted to switch over, you're already trained by the time you get over there.
I'm usually a med-surg nurse. I am a med-surg nurse, but crossing over, training on OB, wanted to branch out a little bit, do something more and round out my experience.
It gives us the opportunity to provide better patient care when we're well-rounded in our skills within the different units within the hospital. And it also gives us the opportunity to train other individuals to different departments, knowing the backgrounds that they may have come from were the same as ours at one point in time.
Teamwork is something that we've always been good at. We've worked together long enough that we can almost, come with me, you know what we're doing. We work as a team always. This is not a place to be an individual caretaker. You have to be a team. And that's what it's about.
We're on it together.
Mm-hmm.
When you have a patient that comes up that is perhaps a little more critical than another. And again, the teamwork, it just goes together like a smooth deck of cards.
The communication within all of the departments of the hospital too has been very good for a long time.
Mm-hmm.
Whether it be respiratory, cardiopulmonary, the lab, purchasing,
mm-hmm.
dietary, what have you.
The Swing Bed program at Maine Coast is a program that we have that we can offer our patients so they can stay here after their acute care stay if they need a little skilled care, rehab, or if they need IV antibiotics. It's really a customer service that we're lucky enough to offer our patients so they don't have to go to facilities further away in other areas where it's more difficult for their families to go visit them.
So a new thing that the hospital has just started, this year is the first time, the medical muster. And it was just this big competition that we had. Anyone could sign up, make their own group of teammates. And there were 3 competitions. One was a bedpan relay, and the other one was a balloon toss with gloves filled with water. And then there was a relay race with a puzzle you had to put together. It was tied to an IV pole. It was very complicated. The winner of the medical muster won this very nice golden bedpan, and we got to put our names up there, the Young Guns. It was a good morale boosting activity, and there was pizza afterward, and I'm looking forward to it next year for sure.
Together we're stronger because we can't survive on our own. We are so vitally dependent on the nurses, the physical therapists, the lab people, the whole entire hospital.
Our team really does shine. We really do care about what the patient's experience is, and we really do try to celebrate each other.
I'm proud of this hospital, and I'm always happy to see the ongoing progression of it and all the initiatives that come through, because this is a good place.
Together we're stronger.
Together we're stronger.
Together we're stronger.